Go.
Hi, my name is Carolina Nunes,
I'm Abby Danette.
and today we'll be doing a demonstration of an advanced airway placement using an iGel. Before starting this procedure, we will be starting by donning our PPE, so our gloves and our goggles.
And then I'm going to start by pre-oxygenating our patient for nitrogen washout with a BVM and nasal cannula, both at 15 liters per minute. We have also dual NPAs and an OPA in place as well. Prior to iGel insertion, we're going to assess our patient for rods. So we're going to look for any restricted airway opening, any obstruction or obesity.
We're also going to be assessing for distorted or displaced airways, as well as assessing for stiffness in the C-spine, as well as the neck and the chest. Following that, we will then be selecting an iGel based on our patient's weight. We have a patient here of 80 kilograms, and we've selected an iGel of 50 to 90 kilograms. We'll then inspect the iGel for any malformations of the iGel, as well as any leaks in the packaging. And once we've confirmed that there are no malformations or leaks, we will open the iGel as well as prep it. So removing the iGel, we'll be removing it from its casing and taking it out of its cradle. We'll be placing a drop of lubrication on the iGel's cradle, and then we will also be applying the cradle or the lubrication from the cradle to the iGel on the anterior aspect as well as the lateral aspects of the iGel, ensuring that we don't get any lubrication within the airway. Once that's already been thoroughly lubricated, we'll place it back into its cradle, and then I will place this in place, which is the iGel hold securing device, and we'll be placing it just underneath the patient's occipital region of the head. And then afterwards, in order to prep this, I will verbalize some instructions to my partner. So I will tell my partner, Abby here, that we'll be removing the BVM as well as the OPA, the 2 NPAs, and the nasal cannula. On my count, I'll have Abby deliver one final breath before we complete the insertion. So Abby, can you repeat those instructions back to me?
Yep, on your execute, I'm going to remove the BVM. I'm going to take off the nasal cannula, take out the OPA, and take out both NPAs, and then get the BVM ready for reattachment to the iGel.
Perfect. So you can go ahead and deliver one last breath, and then on the count of 3, 1, 2, 3. I will adjust the patient's airway into sniffing position to ensure that it's still maintained, and insert the iGel along the hard palate until I feel resistance in the patient. That's as far as it'll go on this mannequin, so you can go ahead.
I'm going to reattach the BVM with the HEPA filter, the end-tidal CO2 monitor, and PEEP set at 5 centimeters of water.
In order to ensure that we're getting appropriate ventilations, I'm going to auscultate the epigastric area as well as the left and right apices and bases of the lungs on Abby's ventilation. So go ahead. And then auscultating the left apices, the right apices, left bases, and right bases. Alright, so we've been able to confirm that we do have successful ventilations with no obstructions to the iGel insertion. Following that, we will secure the device in place so that there's no movement from it.
And I'm going to continue to ventilate at 1 breath every 6 seconds and monitor end-tidal CO2 waveform to be in the proper range.
Perfect. Following that, we will then insert a French catheter that we've already marked in place. We've measured it from the tip of the earlobe to the patient's edge of the mouth. We've also marked it off so that we don't insert it too far into the airway and cause any damages. We will also be attaching the opposite end to an already tested suctioning device, and we'll be setting our suctioning device to from 30 to 80 millimeters per mercury, and then we'll be suctioning once every 5 seconds for 5 minutes as needed.
Thanks for watching!